Today marks World Malaria Day, and it's being observed under the theme Time to Deliver Zero Malaria: Invest, Innovate and Implement. According to the World Health Organization, malaria cases stood at around 240 million globally in 2021, with nearly 620,000 deaths. For more on this and the stats on the African continent, we're joined by Dr Chris van Straten from International SOS. Thank you very much, Dr van Straten, for your time. Can you start off by giving us some context on the current state of malaria in Africa and possibly the countries most affected?
All right, thanks so much for inviting me to join the call. Malaria is, as you said, over 620,000 people died in 2021, and the 95% of that was on the African continent, and the most effective, 80% in children under the age of 5. The countries most affected is around the equators, so it's the DRC. Countries like Nigeria reporting the highest number of cases, also the highest number of deaths. And the reason we really want to emphasize delivery on zero malaria is that it's possible to beat malaria. Since 2015, 9 countries, including Algeria, were able to eradicate malaria. In other words, no malaria detected for over 3 years. So it really can be done, and that's really what this International World Malaria Day is about.
Looking at those high incidences of infections and the impact on children specifically, talk to us about the breakthrough vaccine for children and what it could mean in terms of preventing malaria, but also, within the context of that rollout. We know implementation, while it's part of that theme, is sometimes a big stumbling block. We have the best laid plans, but implementation sometimes is where we struggle.
Absolutely, and a great question. Vaccines for malaria, the medical community has been trying to develop these for decades, and it's been really challenging. The malaria parasite is able to mutate. It has a complex life cycle, and up till about 2012, we weren't particularly successful. And then the scientists developed something called RSS, and the United Kingdom, they came up with R21. And these vaccines have been rolled out in Ghana, Kenya, and Uganda. Millions of children have had the vaccines, and the initial data that we're getting in is looking really positive. And what we mean by that is significant reduction in children contracting malaria, significant reduction in children getting severe malaria, needing to be hospitalized or dying from malaria. So it really is very encouraging. The studies need to be completed. There are some potential other vaccines in the pipeline. And then once that's been completed, as you said, you might have the technology, but being able to mass produce and to deliver to the people where they need it most, as we saw with the COVID pandemic, that can also be a significant challenge. But there are government and private entities looking at this, including WHO, CDC Africa, and Gavi, playing a huge role in that and partnering to make this happen. So it will take time, there will be challenges, but I am optimistic.
How can organizations contribute towards achieving that goal of having zero malaria on the continent?
Right, I think the first thing to do is look at history. Where have we eliminated diseases or malaria? I was looking at a map of Mississippi in southeastern America dated 1870, and they were battling with malaria, and it is eradicated. Countries like Algeria, Cambodia in Asia is well en route to eradicating malaria. So I think we need to look at where we've had success. How was that success achieved? And it's usually through a multi-layered approach. The individuals, I love talking on programs like this because here we can educate and spread the word, and we got to keep doing it. Whether that's business, the wellness, outreach, television, radio, we can all play our role in spreading the word. And then also these collaborations, private, government collaborations to build the technology and distribute where we can and need to.
You mentioned the COVID-19 pandemic, and during that global pandemic, we really saw a need for increased communication to people where they find themselves and in mediums that they find accessible. So when we look at promoting awareness in communities for the prevention of malaria, how are we doing in communicating that message in a way that communities can really come on board?
Great question. Right, so one has to be, you got to meet the people where they're at and in the language and in the culture that they're comfortable and used to. One of the initiatives that the WHO initiated during the COVID pandemic was a series on misinformation and myth busting. It was part of that training. It was a lot of fun. And part of the message key thing there was, one, you've got to engage the community. Now, I'm a nerd, right, and I like nerdy talk, but it doesn't help throw in big numbers of people, especially if it's not where they're comfortable. So what has been exciting to see, and especially with the COVID pandemic, we're using the same with malaria, it's getting people engaged in different countries, getting the communities engaged to say, how do you need this message translated, related, and amplified? And using technology to do that. And we are in an age where social media is a blessing and a curse, but if used correctly, has had a very powerful impact on being able to support people. But we've also had to find the myths and bust them before they caused further undue damage and harm. So it's a work in progress, but there's a lot of effort from WHO, Ministries of Health, CDC, private enterprise also engaging this. And we're going to keep going, and we're going to get there.
Absolutely. Thank you so much for speaking to us. That was Dr. Chris van Straten from International SOS speaking to us on this World Malaria Day.